Hi, I'm Graeme, Chief Exec of SCMA. It's been a little while since I last recorded a video update for you, but there are a lot of really important things happening at the moment which members need to be aware of. We know you're all really busy, but please take 10 minutes out to watch or listen to this, even in the background while you're doing something else, as there's information that you really need to know at this time. So I'm going to cover a few key areas as quickly as I can. Firstly, the very real risk that more COVID restrictions could be reimposed, which we believe would be really damaging for childminding and the economy, and importantly, what we can all do at this time to avoid this. I'm going to update you about the unsustainable workload of many childminders and our latest activity aimed at tackling the bureaucracy which has been causing childminders to leave or to think about leaving the workforce. I'll provide a short update on self-isolation, and we know that the information is of concern and contradictory to many of you. And finally, I'll say a few words about what we are doing to influence ELC offers for parents at this time. So firstly, COVID. I recently linked into a meeting with John Swinney, who's the Deputy First Minister and Cabinet Secretary for COVID Recovery, along with leaders of around another 150 organisations who'd been asked to attend the meeting at short notice. The meeting also featured Dr Gregor Smith, who's the Chief Medical Officer, and Professor Jason Leach. Organisations in attendance covered a wide range of sectors, including retail, events, hospitality, travel, education, childcare, and also faith groups. And during the meeting, some pretty stark data was presented, reporting that cases of COVID are the highest have been in Scotland during the pandemic, and are continuing to increase rapidly. This spread is in every part of Scotland and not restricted to certain areas. Now, positively, due to the progress in vaccination, both deaths and levels of hospitalisation are much lower. But the Scottish Government believes cases will continue to rise and risk overwhelming the NHS, including general practice, which has a massive backlog of patients requiring physical appointments. The Scottish Government believes this situation will require some restrictions to be reimposed if we don't all take collective action now to avoid this. We were all asked to do what we can by engaging with our staff, members, families and friends to stress the 4 measures which we all need to take just now. So firstly, be double vaccinated, take twice weekly lateral flow tests, follow and go above and beyond the guidance. And where employers have started to take non-essential workers back into workplaces and offices, to pause this and continue working from home as much as possible. Now in SCMA, we know that members have been going above and beyond for the last 18 months, and we can't keep asking you to do more. We also recognise that for childminders, your setting is also your home, and that you've been extremely careful in following the guidance to reduce risks, both for the children using your setting and also for your own families. However, what we can do is ask you to make families and friends in your own community aware of the situation and to impress the importance of being double vaccinated, taking twice weekly LFTs, and also of following the social guidance. Now, I'm sure most of us will be aware that public compliance with the social guidance has dropped off. I feel like an outlier when I go shopping locally and I still use hand gel and spray my trolley. So many people just walk past. Similarly, mask wearing has dropped off. This is completely understandable. After 18 months, it's hard to keep following the guidance. But tightening up again could make the difference just now in avoiding restrictions being reimposed. If we don't and restrictions are reimposed, the impact on not just childminding and also the economy, socially, mental health and well-being could be disastrous. As such, we'll be continuing to advise the Scottish Government that they should hold their nerve at this time and not reintroduce restrictions. But a collective effort will be required by us all to support this. Moving on, we know that many of you are exhausted and overwhelmed just now, partly due to the additional requirements during COVID, but also due to the excessive demands placed on your time by increasing levels of bureaucracy. This has been worsened by a range of organisations trying to catch up for time that we've lost during the pandemic. And within recent months, we've had ELC coming back on, a new quality framework, and various national consultations. This is all happening at the same time. Much of it is uncoordinated, and many of you quite rightly feel swamped. SCMA has been aware of these issues and working away in the background for some time on this. Most significantly, our large-scale survey last year, to which almost 1,500 of you responded, found that the main reason childminders have been leaving the workforce, or are considering doing so, was the level of bureaucracy and paperwork associated with childminding practice. Now, there's no quick fix to turn this off, but we've been working strategically to change this Firstly, by using this data to secure a new action plan on childminding, and also to inform ongoing workforce research that Ipsos Mori have been undertaking on behalf of the Scottish Government, Care Inspectorate and SCMA over the summer. The findings of this research will then be used to inform future policy actions. Our latest action last week took the form of making a detailed submission to an independent expert group reforming the SQA and Education Scotland. Now you might wonder why this is relevant to childminding. This work will involve removing the inspection function from Education Scotland, and this is an important area which we and other childcare providers need to influence. 6 years ago, the Scottish Government charged the Care Inspectorate and Education Scotland with developing a single shared inspection. 6 years later, this hasn't happened, and what we've had is a separate framework and inspection by the Care Inspectorate, and for those of you delivering funded hours, a separate framework and possible inspection by Education Scotland. Now this isn't the only problem that you're facing. Over a period of years, we've had a series of standards, frameworks and policies which have all been layered on by statutory stakeholders, and for childminders this is becoming completely unsustainable. Nurseries are also being hit by this, but it's affecting childminding disproportionately, as you don't have teams of staff to help you with this. Most of you are sole workers, you're practising during the day, and everything else is having to be done unpaid in the evenings and at weekends. Quality assurance, CPL, admin, finance, marketing. You need more support, and you also need fewer demands on your time. And as an organisation, we're committed to changing this, and we need others to do the same. As such, in addition to making this submission to the expert group, I also personally sent it to senior officials last week in the Scottish Government and Care Inspectorate, calling on them to recognise the issues and to join with SCMA in a multi-stakeholder response which will maintain quality assurance but with lighter touch, joined up and more proportionate requirements on you as childminders. Now, while we've all been busy responding to the many challenges presented by the pandemic, we do believe there is a need for other stakeholders to inject some pace into this area now. I'll not speak much longer as I know your time is precious just now. So moving on, self-isolation. We know this is still unclear and contradictory, and I'm going to take two separate issues. Firstly, can a childminding setting stay open if a family member living in the household tests positive, but the childminder is double vaccinated and tests negative? We'd engaged the Scottish Government on this, but given increasing concern about rapidly rising cases mentioned earlier, we don't believe there'll be any movement on this at this time. So the position remains the same. A setting must temporarily close if there is a positive case in the household, regardless of the vaccination status of the childminder. Secondly, many of you have contacted us concerned by the loophole in which an under 5 does not require a test, even if one or both parents test positive, and the child can still attend your setting, or in the case of funded hours, is required to, due to contract and payment. In such cases, members have been highlighting that while they want to support families, this feels contradictory, and members are taking all of the risk, as if the child transmits infection, the setting will have to close and you lose income. Again, this is an issue we've engaged the Scottish Government on, and we're pushing back on this, as the gap feels even more contradictory now, given the recent request to redouble efforts and to prevent the spread of infection. So we'll update you as soon as we can on this. Finally, we know you're also getting swamped by survey requests, but we have one final small ask of you. We're aware that a number of you have contacted us about ELC and have reported a mismatch between the funded hours that parents want and need and what is offered to them by their local authority, sometimes including in some cases just single offers at fixed days or times, and also including a requirement to use a local authority nursery. Now, understandably, this is causing concern to members who are concerned that they might lose business due to this, and it's also distressing to the families. So every year we are commissioned by the Scottish Government to undertake an audit of where local authorities are at including childminders in delivering funded hours. We didn't do it last year due to the pandemic, but we reintroduced it this year and work is currently underway. However, we recognise this is one-dimensional and that it only captures data from local authorities. So this year we're also surveying childminders and we're surveying parents separately to capture their honest experiences of ELC, good and bad, and how much this matches their needs. This information will be hugely helpful in informing understanding about what is actually happening locally and nationally. So we will use this at a national level in discussion with the Scottish Government. So for the childminding survey, please do complete it, even if you're not interested in ELC, as understanding the reasons for this will also be extremely helpful to us. It will only take 5 minutes of your time. And also, please do share the parent survey to the families you support and to friends who have preschool children. The more parents who complete the survey, the better. Again, they don't have to be using a childminder. We're also interested in their experiences and we'll use this at a national level. Both surveys are currently live at the moment and you'll shortly receive reminders again about this for completing them and how to share them. I'll also record a short video for parents. So once again, many thanks for all that you do to support children and the families in your community. You do hugely valuable work, and while it might not always feel like it's fully recognised by others, we are committed to changing that for you. Stay well.